All right, thank you very much. It looks like we can start. Very, very good morning to everybody who is present here. Special greetings to senior officials in the department. The Director General, Dr. Sandile Buthelezi, will join us very, very shortly. I'd like to welcome all our senior officials, to welcome all of the experts and panelists who are going to be speaking today. And I would also like to welcome members of the media and also members of the public. My name is Dr. Lwazi Manzi. I am a communicator from the Ministry of Health, and it's really my pleasure to be here this morning as part of the launch of COVID Alert SA, which is a powerful new digital tool that is going to assist us in the fight against COVID-19 through contact tracing in the digital sphere. Now, South Africa is one of the countries that is actually cited as a leading nation in the COVID-19 response. And the reason for this, one of the reasons for this is that we have been led very strongly from the front by the President, His Excellency Cyril Ramaphosa, and the Honorable Minister of Health, Dr. Zweli Mkhize. But more importantly, South Africans have all come together from all spheres of life to really link arms as a formidable front against this unseen enemy. And we now have a tool in the modern era that is going to bolster our defense front. And even more exciting is that this is a tool that we can take forward into the future. And this is a tool that ensures that we are very well prepared for any other pandemics that could come. And also it will assist us as we move forward into universal health coverage through the National Health Insurance. And so without much further ado, we're going to first ask that the launch video be played, after which I will then introduce the panelists, and we will open, if DG has not joined us, we'll then ask Dr. Anban Pillay to just give the opening remarks after the launch video. Thank you very much. If we could please play the video.
A powerful new tool to support our digital contact tracing efforts.
The coronavirus has disrupted all of our lives. The sooner we can defeat the virus, the sooner our economy will recover, and the sooner our lives can return to normal. We all need to play our part in preventing a second wave, to protect ourselves, our families, and our communities. That is why today we are launching a powerful new tool that will help us to contain the coronavirus and prevent a second wave of infections. The Department of Health has developed a mobile app called COVID Alert SA, which uses advanced Bluetooth technology developed by Apple and Google to notify you if you have been exposed to the coronavirus. Using the Bluetooth, the COVID Alert app exchanges a random code with other phones that are close by. If you later test positive for COVID-19, you can use the app to notify all other users that you have been in contact with during the past 14 days. All phones that have exchanged codes will receive an alert with instructions on what to do next and how to take care of yourselves if you have been exposed.
The app is designed to protect your privacy and does not track your location or collect any personal information. If you report your diagnosis, you and your contacts will remain completely anonymous. If you take a test for coronavirus, you will receive a unique COVID PIN via SMS that you can use anonymously to report your diagnosis in the COVID Alert app. You will also receive a link to the COVID Connect WhatsApp channel where you can safely share your contacts. The more South Africans download the app and engage with the WhatsApp channel, the more effective we will be in stopping the spread of the virus.
Now more than ever, the power is in our hands. Download the COVID Alert app today and add your phone to the fight.
The power to defeat coronavirus is in our hands. Play your part. Stay safe. A message from government.
Well, thank you very, very much for that introductory video. The power is in your hands, South Africans. You are now able to download this app and join us all in the fight against COVID-19. Now, if I may introduce the panelists that are going to be with us this morning to explain this app further. We have the Deputy Director General, Dr. Anban Pillay. There's also Dr. Gail Andrews. She will not be speaking, but she is available to answer questions if there would be any questions directed to her. We then have Gorang Tana from the National Department of Health, who is the COVID Alerts Project Lead and the Head of Policy Coordination and Integration Planning. Dr. Kerrigan McCarthy, we all know very, very well from the NICD, who has been intimately involved in ensuring that this app actually works and is practical. We're very, very proud and very happy to be joined by Maria Carpenter from Discovery, Head of Digital Channels. Discovery, with other partners, has been very, very intimately involved in the development of this app. Thank you very much to Emma Sedler, who is a digital media law expert. I'm sure many of you have questions about privacy and the legalities around this app. We're very happy that she's been able to join us. And then we also have some senior legal counsel who have also joined us as well. And thank you very, very much for joining us, Stuart Scott. We really appreciate that you could be here with us today. I will therefore allow DDG Dr. Anban Pillay to just give some opening remarks. When the DG does join, we will give him his opportunity to then also make remarks. Dr. Pillay, thank you very much. We will begin with you. Thank you.
Thank you very much, and thank you for the opportunity. I think this is a significant step in our fight against COVID, because as we ease our restrictions at level 2, we need to guard against the resurgence of COVID in our communities. One of the great challenges that we have is we often move around but have no idea about the people that we're interacting with and what risk that may pose. So to combat the break in the chain of transmission as we interact with people, we need to have some sense about who it is that may potentially have COVID and may be able to transmit it to us. So this application provides us with the Bluetooth-enabled contact tracing application, which will improve the contact tracing process. It's basically an automated notification of proximity to a person infected with COVID. So if you're in contact with somebody who's infected, it will alert you. It will also provide privacy prioritized and protected so that your information is not shared with other people.
I say you missed me, but it's fine.
The COVID alert app is world-class, which allows for the power to save lives. And we all need to play our part in preventing this. And the way we can do that is to make sure we firstly download the app, and then secondly, encourage all our friends and family and those around us to also do the same. So if we can maintain a circle around us that is alert against COVID, the likelihood of us being infected and our friends and family being infected is minimized. Thank you.
Thank you very much to the Deputy Director General, Dr. Anban Pillay. I'm now very pleased to ask the Director General of Health, Dr. Sandile Buthelezi, who has now joined us, to give his remarks. Thank you very much for joining us, DG. And just to alert everybody that we will unfortunately need to let DG go after he's given his remarks. However, the rest of the officials will remain behind to answer questions. Thank you, DG.
Thank you very much, Dr. Manzi. Thank you, Dr. Pillay, other DDGs present, representatives from Discovery Health, the Senior Legal Counsel, other partners. We are very honored this morning that finally this dream has finally come true. It's been a lot of work, and I must really thank Discovery. I must thank the team led by Gorang on our side, under the leadership of Dr. Gail Andrews. I must thank Dr. Kerrigan McCarthy, one of our own from NICD, who's been very instrumental in ensuring that we are finally where we are today. It's been a lot of work, it's been a lot of thoughts, it's been a lot of contributions. However, we're now at the point where we're really putting this product at the hands of the South Africans. As Dr. Pillay has mentioned, it's a time now where South Africans must take charge. But also it's up to them now to actually be part of the solution in terms of ensuring that we are able to contain the infections, we are able to stay where we are and not actually reach out to the second surge as a country. So this is a breakthrough, and we also thank the leadership that has been displayed by our president, our Minister of Health, the members of the National Command Council, the members of the NAT joints, in terms of leading from the front in fighting this work. So there's a lot of interventions that have been put in place. This intervention now, this technology is going to help us as a country to be able to detect if you've been actually exposed. But what's more important is that we need to ensure that we now communicate to the South Africans to be able to download this app and ensure that the Bluetooth is always enabled so that we are able then to get the notifications. I therefore thank the panel for availing themselves today to explain it to the public and also to ensure that we actually encourage and increase the appetite for the South Africans to download the app. I wish you the best. Unfortunately, I have to join the cluster meeting. But on that note, you are at the safe hands of the team from the department led by Dr. Anban Pillay. Thank you very much.
Thank you very, very much, DG. And really, we appreciate that you were able to avail yourself for this very, very important launch. Thank you. Now, I'd like to invite Dr. Kerrigan McCarthy from the NICD to just talk to us about the utility of this app in the context of COVID-19 pandemic in South Africa. Thank you, Dr. McCarthy.
Thanks, Lwazi, and morning, DG, members of the team and visitors to the Zoom call. So we all know that we've reached the peak, we think, of the COVID outbreak in South Africa, and that we're on the way down. But what is also a consideration is that many countries who have been in a similar situation to us are now experiencing a second wave of COVID infections. And what the World Health Organization has shared with us, and what we know to be true, is that contact tracing is an essential and integral part of COVID-19 containment at a population level, but also within institutions and businesses to keep us going. And paradoxically, contact tracing is far more important as we approach the second wave. And the reason for this is that as the number of cases decline, the size of the second wave will be dictated to the degree to which we can control and prevent COVID transmission. If we can do this successfully, we can minimize the impact of a second wave, and or unlike Spain, which is at the moment experiencing a similar number of cases per day as they did at their peak, we may be able to avoid a second wave. The World Health Organization and the Global Outbreak Alert Response Network recommends that countries use a multimodal contact tracing method. That means that they advise us to use manual contact tracing methods where teams of people go and find cases of COVID and interview them to find out who their contacts are and then trace their contacts, but also that we use digital methods alongside these manual methods. And a number of other countries who have experienced more of the COVID outbreak or are further ahead in the epidemiology are doing similar things. So, for example, after an index case has been identified in Vietnam, a number of digital methodologies are used to help that person track their location in order to facilitate and identify contacts. A recent review in the Global Health and Research Policy Journal lists the digital contact tracing apps in a number of countries across the world, and these are free with websites for you to be able to go and see them. So it's wonderful that in our country we have this offering to facilitate digital contact tracing. I'm going to hand over back to Lwazi to continue with the presentation. Over.
Thank you very much, Dr. McCarthy, for that insight. We really appreciate it. And I would like to invite Mr. Gorang Tana to just take us through the actual mechanics and utility of the COVID Alert SA app. Over to you, Gorang.
Thanks very much, Lwazi. Thanks, DDG's colleagues and members on the Zoom call. I think, as Dr. McCarthy have said, at the onset of the pandemic, we started manual contact tracing, and this was done primarily through phone calls and home visits. Over the past couple of months, we've started introducing digital methods in a phased manner. So colleagues would know that in March already, we introduced the WhatsApp channel, largely for health promotion, to ensure that users can get the latest COVID-19 news, information, prevention tips, wellness advice, etc. Roughly a month later, we started a screening program, also available through this WhatsApp channel, and has attracted in the region of 7.5 million users to date. And recently, about a month and a half ago, we extended that capability to actually monitor the health status of index cases, the positives, and give them the ability to report contacts anonymously through the WhatsApp channel. And the reason for choosing these technologies was largely because of their penetration in South Africa. Most recently, as an additional modality, if you like, what we did is we're introducing this COVID Alert app. And this COVID Alert app, really the benefit here is that you're able to notify your derived contacts. So with the manual contact tracing method, as well as the digital method of reporting known all you're doing is you're reporting contacts known to you. You would not be able to report contacts that you may have encountered while at a supermarket or a taxi or a bank or a post office. And what the mobile app allows us to do is allows you to inform those that may have come in close contact with you at these public places, and essentially helping us target those derived contacts that you may not have known that either you were exposed through them or they may have been exposed through you. And so the other benefit is that it's a very privacy preserving app. It does not track your location in any way. The communication between yourself as an index case potentially and your contact is all anonymized, which you would see shortly through a demo that we would do. Thank you, Lwazi. Over to you.
Thank you very much, Gorang. And now let's immediately move on to the demo. Thank you very much, Maria.
Hi, everyone. Thank you, Lwazi, for the introduction. I feel very privileged to be representing the Build team, and that spans across Discovery, the National Department of Health, as well as the BCX team. It has been a very big team effort. I'm going to take you through 3 simple steps on how the app works, and as well as an explanation of the exposure notification system. So let's get started. Step 1, users will have the opportunity of downloading the app through either the Google Play Store or the Apple App Store. We are absolutely working on the Huawei version of the application, and have started working with the Contact Shield API. And that shall hopefully be available in the next few weeks. And then that's it. Once a user has the application on their device, they can then open COVID Alert and get started. we've got a very detailed onboarding journey that we start a user's experience with. And the reason for that is we want to provide rather more information than less. And while this seems very text-based, there is a reason for that. We need to keep the app as small as possible to ensure as many South Africans are able to download it and have it on their devices. And so we were very pleased that we were able to keep the download size under 3 megs. So that's 3 megabytes, which is, yeah, it's a very big accomplishment of the development team. On this screen, you can see that we talk through notifications. Here, a user has explained how they will receive notifications, send notifications, and we also go into some detail around privacy, and then explain that they will be provided next steps. And those are next steps in how to take care of their well-being if they do test positive. Next, we detail the notifications element of the application. And here, there is a new setting that has been added to our devices for Apple and Google devices, and this is the exposure notification. And I'm sure many of you on the call have seen this setting already. This is the heart of the solution, and this is what has been developed by Apple and Google to allow us to understand who we've been in contact with over the last 14 days. It is through this setting that our devices are able to randomly generate codes that will be used to identify myself as the user of this device and also you as a person I've come into close contact with. At any time, you can turn off this notification. To use the application, you must enable it. And this is the same setting that's being used globally around the world for managing contact tracing through smartphone applications. The next notification is just a simple notification which must be turned on, and that's to allow the user to receive notifications, and that would be the setting to alert them if they have had a possible exposure. And then the last information that we use for onboarding is just an explanation of alerting others, and this is where you will share your positive diagnosis with other users, always anonymously. We then move on to the bottom navigation. There are 3 options on the bottom nav: exposures, alerting others, and learn more. This is the landing screen of the application that you see before you. And the green banner indicates that there have been no exposures. Moving on to alert others, this is where you can alert others of close contact, and we'll go through the journey a bit later, and then learn more. This is explaining at any time you can get additional help on the application, especially if you've missed some points during onboarding. You can then access Learn More while using the app, and all your questions can be answered. There's a lot of detail on the screen, so I'm going to take you through a bit more detail on that Learn More and what's available. So again, we go through how it works. Receiving notifications if you've been in close contact with other app users, sending notifications, and privacy. So you can see a common theme is privacy. We bring it up often throughout the usage of the application, and it'll always be important to us, the developers and the government. About the app, you can see very clearly that this has been a government application. This is an application, and again, some more information on how it works. There's a terms and conditions link, and that is available on the website as well. There is an SA Coronavirus website which has all this information readily available to users too. Some more detail on privacy. We absolutely do not track location through this app. It uses Bluetooth randomly generated codes, and no location is collected or stored at any time. Just a note on the random codes as well. Random codes are generated by your device every 10 to 20 minutes. A new code is generated for your device, and it's random, and it is always anonymous. We have a next steps section, and this is for possible exposures, as well as for if you have tested positive. This is to help users in managing their well-being. We really want people to feel healthy at all times. And if they are sick and they are into self-quarantine or self-isolating, we absolutely want to stay in touch with them. And we can do that through the WhatsApp channel that Gorang mentioned earlier with COVID Connect. We have links to the WhatsApp chatbot. We've got the 24-hour hotline. And so while the application has been set for contact tracing, and we care about contact tracing as the premise for building the application, we mostly care about people's well-being and keeping the country healthy. And that's it for Learn More. Moving on to exposure notification. So this is the crux of the application. And we've just put together a short explanation video of how this works. So every 15 minutes, your codes are randomly generated, every 10 to 20 minutes. In this case, what you're seeing on screen, person A and person B come into contact with each other. They spend approximately 15 minutes together. And during that time, codes are randomly generated by their devices as they have turned on the exposure notification. They've enabled it on their devices. Person A does not know person B. About 6 days later, approximately 6 days later, person A starts feeling not great, and they decide to go for a COVID-19 test. They then receive an SMS from the department with their results. This is an SMS that is sent to everyone in South Africa who goes for a test, and they find out that they've tested positive. They choose to alert other app users that they have tested positive. The first step is to go into their SMSs and find the PIN that has been sent to them by the department. It's a 6-digit PIN. They'll then open the application, use the bottom navigation to alert others. And here they will use the PIN as well as their date of birth. Now, the reason that we've added date of birth is another layer of privacy. So while the unique PIN is sent via SMS, in the event that that SMS is misplaced or somebody else has access to it, this is another step to prevent any misuse and also to ensure that there was actually a positive diagnosis. It's very important to the integrity of the system that only positive diagnosis keys are updated and uploaded to the exposure notification server. We also ask as many times as possible for people to be sure that the action that they have selected is exactly what they want to do. And then that is it, the diagnosis has been shared. You'll see on the screen, there is a next steps arrow, and this is taking the user back to the suggested next steps where they're asked to self-isolate, they must monitor their symptoms, and again have access to the numbers and the WhatsApp chatbot. That's the end of the journey for person A. Now moving to person B. Person B receives this exposure notification on their device. They open the app and the green has turned to amber. They then open next steps and they can see, firstly they're asked not to panic, and then they're told that they should self-quarantine for a period of 10 days, monitor their symptoms so that if anything changes and they do start feeling very unwell, we give them instructions and help on what to do next. And so the demo has been kept, the application has been kept as simple and clear as possible. It's been a pleasure working on the application, and if there are any questions, we'll take them later. I'm going to move back to Lwazi. Thank you.
Thank you so much, Maria. South Africans, 3 megs. We are not going to eat your data, and thereafter it's 0 rated. So please do download the app and take the power back in your hands in fighting COVID-19. Now it gives me great pleasure to invite our legal experts. Emma Sadler will open for us, who is a digital media legal expert, and she will give her remarks on the legalities that surround this app. And I believe that she will be supported by some comments from Stuart Scott, to a senior legal counsel. Thank you very much. Over to you, Emma.
Thank you very much, Lwazi. I'm actually going to hand over to Stuart Scott to give a bit of an introduction on some of the legal aspects. He has been working with Senior Counsel Stephen Budlander on this, and then I'll pick up on some comments when he's finished.
Right, thanks very much, Emma. So thanks very much for having me. Stephen unfortunately couldn't be here, but it's a privilege to have been involved in this process, and often, well, more often than not, probably, Stephen and I are involved in challenging various government action on the basis of privacy. So we have a sort of detailed human rights background, and it's been a pleasure to be advising on this score. From a privacy perspective, there are 2 key features I'd like to emphasize. And the first is that the app functions, as has been said by Maria, on an entirely anonymous basis. So that means that there are no identifiers of your phone, of your number, of your identity, your address, or your location. There's no GPS and location tracking that takes place. And the app cannot be used in any measure to track you, nor can it be used to access your personal information. In other words, the app doesn't have any access to your emails or your contacts. And the second key feature from a privacy perspective is that every stage is completely voluntary. So privacy law is all about control. And the app does this at a variety of levels. So the user of the app in the first place decides to download the app, to keep their Bluetooth on. Then if they test positive for COVID-19, they decide again to share their status anonymously. And at any stage, they can decide to terminate the app. So if they decide that they no longer want to be part of it, they can just delete the app from their phone. So as Maria mentioned, and this again goes to the point of making sure that people understand how the app works and what information is taken, there's a detailed onboarding process. So the user gives what's called informed consent. In other words, they understand exactly what they're getting themselves into. And perhaps before I hand over to Emma, I could just mention that if anybody had any sort of concerns about privacy, we note that countries around the world are using the same Google and Apple sort of technology. And Germany, which is regarded as being a very strict privacy nation, they are also using the app. And I believe on the first day that the app was put onto the App Store, they received 6 million downloads. So there's been a huge uptake in Germany and all over Europe. So from a privacy perspective, in vetting the app and the legal perspective, we were both Stephen and I were both satisfied. So over to you, Em.
Thank you, Stuart. So I think that gives quite a broad background into the privacy considerations. I echo what Stuart said, and that is that I am a privacy advocate. And I always worry about downloading any new app, clicking the button that says I agree to your terms and conditions, and worrying about what I give up in order to use that app. And there are always privacy concerns when we're using technology. I think as soon as there are they're using your location, people start feeling nervous about privacy and start feeling a little bit like Big Brother is watching them. And I have been through the app in detail with the developers, and I am entirely satisfied that it is sufficiently anonymized to make anybody who is nervous about their privacy infringement not be worried, because it is anonymized. They don't collect any of your personal information. No name, no email address, no phone number, no location is collected or stored. And because it's entirely anonymous, those privacy concerns, and if you've been following POPI, the new data protection law in any way, you'll know that as soon as personal information is anonymized, then it falls outside of the realm of POPI, which is our new privacy legislation. So for me, there's no question I'll be downloading the app. I will be using it. I'll be telling my friends to use it. I think that the success of this app will rest and fall on the extent of the uptake. And it relies on people to opt in. And what we've seen around the world is governments bringing out different versions of contact tracing. And this is very distinct to what you see. For example, I've got a friend who lives in China. She's teaching English there. And every time she leaves her house, she has to log where she's going. She has to scan a QR code every time she goes into a shop. If she spends too long outside of her house, the authorities come and have a chat to her. This is certainly not that. This is really very minimally invasive of people's privacy. And I would say that the benefit far outweighs any potential risk. And to be honest, I can't see much potential risk because it doesn't collect your personal information, it doesn't store your location, and it is entirely anonymized. So from my point of view, the privacy concerns have been very carefully managed, and I think that we should be encouraging really the whole public to download this app and to quell any privacy concerns that individuals may have. So I think that's it. There may be some questions later, but for now, I think we're going to hand back to Lwazi.
Thank you very, very much to our legal experts for that reassurance. It's very, very reassuring to know that one's privacy remains protected, while at the same time, one is able to protect themselves and others from the ravages of COVID-19. Really, thank you very, very much. Thank you so much to all of the panelists. I very much appreciate that the presentations were kept short and to the point, and the clarity with which they have been delivered. The people of South Africa, I'm sure, are very, very thankful. What's most important now is that, one, if you do go for a COVID-19 test, that you provide the correct cell phone number so that we are able to contact you and we're able to provide you with your results. And of course, it's very important that as many people as possible download the app. You never know if you're going to be at a supermarket or a park or a beach or a play or the cinema, and you find yourself in contact with somebody and you may not recall who that person is. We know who our friends and our families are, but we've opened up the economy now, we've opened up our spaces, and we don't know everybody. And so this is what makes this particular app very, very powerful, in that we're able to exchange information anonymously with people that we don't know, but we are at the same time protecting each other as South Africans, even though we don't know each other. So we now will open up for questions. There are several ways that you can pose your questions. You can either send them directly to me if you have my number by WhatsApp, or you can of course pose your questions in the Q&A section. And I see there is, I'm not sure if it's a question or a comment, but I will read it out already. Of course, you can indicate if you'd like to actually make a live question, and I will ask our admin, Zweli, to just indicate if there's anybody who would like to ask a question live. And apologies, there is, one more slide where we would really just like to acknowledge all of the partners who have been involved. South Africa, you must know that if you're dealing with an app that is so simple to use, that there has been a huge amount of work that has gone on behind the scenes to ensure that the application is user-friendly and practical. And so I'd like to hand back over to Dr. Anban Pillay, our Deputy Director General, to just acknowledge all of the very, very important partners who have been involved in this breakthrough project. Dr. Pillay?
Thank you, Luazi. I think this project would not be possible without the support from a number of partners, Discovery Health in particular, but I think a number of banking institutions, as well as the telcos, have played a critical role. And I think you see the names of the banking institutions that have been very important in the support of this app. They're going to be certainly promoting this app to their clients, and we'd like to thank them for doing that. We'd also like to encourage you to promote the app to your friends, family, and colleagues so that this can be widely distributed. That's the best way for us to provide protection. And then also to the telcos, and you see a number of telcos at the bottom, Cell C, MTN, Telkom, as well as Vodacom, who have played a very important role with this app. They've zero rated it, which is great. And in addition to that, they're also going to be marketing this app. And a big thank you to all of them for their support in trying to keep South Africans safe. Thank you very much.
Thank you very, very much, Dr. Pillay, and a huge thank you to all the partners. A beautiful example of public-private, multi-sectoral partnership. This is the way of the future. This is the new normal. I do have some questions in the Q&A section, which I'm going to read out. And I will see if I can't assign the questions. Otherwise, any of the panelists can take the questions. I'll read them all out at once, and then we'll take all of the answers. We do have 20 minutes left for Q&A. The first, I think it's more of a comment than a question, but we can respond to it, is from Dr. David Johnson at UCT. He says that using projections of 2018 PEW and after access study, our smartphone penetration for rural areas of between 49 and 52% of the rural population, and between 63 and 69% of the urban population. I think what he's really just saying here in a nutshell is that to be able to actually or rather this is kind of the penetration that one can expect to maybe see. Metcalfe's law says that if we get near to maximum urban uptake of approximately 60%, we will be able to detect only 36% using Ferretti's projections. This level of contact detection will only be useful in reducing spread, that is the R0, if we isolate more than 80% of cases and notify their contacts immediately. For success, it will be critical to supplement the system with others such as COVID-ID from UCT that uses QR codes and doesn't need a smartphone and manual contact tracing with quick notification times. And that's the end of his comment. Before I hand over to Gaurang, because I know that he will, I'll ask Gaurang to answer this question, but I would just like to comment by saying, indeed, what we do want to have several options for South Africans to be able to choose from. South Africans who don't have smartphones, South Africans who do have smartphones, and all contact tracing efforts are welcome. Government is putting in their efforts, but as you can see, there are many partners involved who come on board into this initiative, and all kinds of technologies are very much welcome in the fight against COVID-19. A question that we've got here: are there not safety concerns from keeping your Bluetooth on at all times? I think perhaps Maria can answer that question. That was from Anonymous. And then I have Khaupalelwe Paletsile, who's asking, good morning. Have we done an assessment to see how many South Africans will be able to download this app in terms of numbers? How much is this app costing South Africa? How does the department plan on marketing and promoting this app so that it reaches all South Africans? And again, I think I will ask Gaurang and perhaps Dr. Pillay to manage that last question. So if we can start with you, Gaurang, to manage that first comment from Dr. David Johnson at UCT. Thank you.
Thanks very much, and thanks. That's a very important question. So we know that digital channels will not do not actually supplement contact tracing. In fact, they only complement contact tracing. So we're quite aware that you wouldn't be able to use. There are limitations with every technology that is available for contact tracing. And in fact, this is the very reason why we started with the SMS and the WhatsApp-based service, which is available much more widely than potentially, potential smartphones that could download this app. We know there are just over 30 million smartphones in circulation. We're targeting 10 million downloads here. So we're targeting a third of the smartphone population to download this app. We know that every 100 infections we avert using technology, we could potentially save quite a number of admissions and probably a couple of lives every 100 infections we avert. So yeah, and every additional modality helps us achieve that goal. So yeah, we would certainly be. This would not be the last thing we would consider. We would definitely consider adding other modalities as and when they become feasible for us to achieve. Dr. Kerrigan McCarthy is also on the line, Lwazi, maybe through you, if she would like to add any comments to what I've just said from an EPI point of view. Thanks.
Yes, please. Thank you.
So thanks, Graham, and thanks, Dave Johnson, for the question. What is critical to remember with regard to contact tracing is that every single case of COVID that is diagnosed and from whom onward transmission is prevented represents an exponential saving or prevention in terms of cases and lives and hospitalizations. And so even if not every single South African is able to download the app, the benefits of fewer COVID cases in the country accrue to everyone. And in that sense, this app represents a common good that translates into improved quality of life, improved economic outputs for everyone. The second thing is that this app has been identified as the best available option in terms of protecting privacy, as has been shared before, and protecting individual user autonomy. And these are key considerations in engaging the will and the motivation of the public to use a app where there is a that requires individual assent and agreement. So both from an epidemiological perspective and from human rights and respect for privacy and autonomy, this app has a fundamental place in the armamentarium of contact tracing. Over.
Thank you so much, Dr. McCarthy. I'm going to invite Maria to comment on the next question, which is about the safety concerns and any other potential issues that you can actually address in regards to the use of Bluetooth. Thank you, Maria.
Thank you. Thanks, Lwazi. And thank you for the question. So what we have seen is that Bluetooth is used widely in corporate applications across South Africa as well as globally, and as well as device manufacturers use it if you look at your wireless speakers. And with that in mind, we do believe that all the benefits far outweigh any potential risks. But let me just explain what we mean by that. We don't believe that there are actually any risks. We do not have any pairing that is required. We do not ask people to pair Bluetooth device with the other device. It is all being managed by the application via the API that's been written by Google and Apple. And just on this point, while we're mentioning and talking about Bluetooth, there have been some questions and concerns around battery drainage using the app. And we have seen absolutely no proof of this. The tests that we have conducted, we did conduct a lot of testing before going live in South Africa with Apple and Google, and we have seen no case to believe that the battery is drained at all, which is great news. And this is largely because Apple and Google developed the API. In previous versions of the application, where Apple and Google were not as heavily involved and countries developed their own apps, in those cases, there were many stories of batteries being drained, and also in those cases, there were some cases and instances of people having security issues come up. This is a different implementation, and we're quite confident in the chosen approach. Thanks, Lwazi.
Thank you, Maria. And then, Gorang, if you can tackle the question from Khapalelwe in regards to the costs and how we're going to promote this app and how many people in this country could potentially download the app. There's actually another question which I've spotted. The very next question, I think perhaps we should bundle it into this set of questions. Who should download the app? Thank you.
Thank you. These are great questions. So let me start with the last one first. Every person living in the border of South Africa should download the app. The fact that we're using Apple and Google's exposure notification service, they have an intention of opening up this across the globe. And so even as you travel into other countries, it would be possible to use the same exposure notification service in their second release to be able to actually achieve the same objective as this app. So the app has got high degree of interoperability between other exposure notification services in other countries, as well as between Apple, as well as Android. There are very few partnerships that Apple and Google jointly collaborate on, and this is one of the, I think, sterling examples of how they've gotten involved to actually, achieve a common goal and help protecting the citizens of the world. On the cost issue, I'd like to maybe through you, Lwazi, Dr. Anban Pillay to answer that question. And then on the comms plan, we've worked with very many partners that Dr. Anban Pillay alluded to. We're working with the large commercial banks, and we're working with the mobile network operators, and we're working with as many corporates as possible to get this to their employees and their networks to ensure that we have high degree of adoption and use of this app. As mentioned earlier, and then maybe to make this a bit more practical, if you walk into a supermarket and you're the only one in the supermarket with the app installed, there's very little value the app would provide. But if you're in a supermarket with 100 people and 20 or 30 of those have the app installed, it's got excellent utility value and potential to curb the infection rate, incidence rate of COVID-19, and that's really what we're after. So we want individuals, corporates, other government departments, public NGO sector, schools, we want everybody to get involved in this and market the use and download this the app widely. As mentioned by Maria, this is less than 3 megabytes. The use is zero rated by courtesy of the mobile network operator. So once you download the app, there is no cost to the user. If anybody without airtime or data on their phone will still be able to use the app, and that's the beautiful part of this app. There are no financial implications here. So we can only request that people join the fight against COVID-19 and in solidarity download the app. A lot like the masks, Lwazi, if I can use that analogy, you wear a mask to protect someone else and another person wears a mask to protect you. We want the same analogy to be applied here. Thanks very much.
Thank you, Gaurang. Dr. Anban Pillay, are you able to assist us with the question on the cost of developing the app?
So the app was supported largely by Discovery Health, and I think most of that work has been effectively done without us having to spend any significant amounts of money in app development, and that's been quite a quick process relative to how long it usually would take. In terms of the communication linked to the app and the costs maybe to that, we're hoping that through social media and social circles, people will encourage their friends and colleagues to download the app, and so the cost of that is largely going to be minimal, because we're hoping that that's the basis on which this app will spread, rather than us having to take out big adverts to get people to actually download the app. Thanks.
Thank you very much, Dr. Pillay. We now have, I think, about 7 minutes left, so we will take the last set of questions. We have a question here from Anonymous Attend. Oh, sorry, we've covered that question. Dr. David Johnson has said, could we use incentivization schemes, example, discovery, vitality, and momentum multiply, etc., data, for example, with data rewards, etc., to incentivize people. I think Gaurang has pretty much covered that indeed we are partnering with big corporates, and I'm sure that they will mechanize and activate all of their mechanisms that they use to incentivize people to come on board an initiative of this kind. The next question, how data intensive is the app? I think maybe I can answer that quickly. As we said, to download it is 3 megabytes. Thereafter, it is a zero-rated app. If anybody else would like to add to that, I think that's the answer to that question. There was a question that was here before that I see has either been removed or has disappeared, but the question was essentially, it was more sort of a comment that essentially said that there's a concern that whilst the app sounds like it's fantastic and will be of benefit, that those people who do not have smartphones are not going to benefit. Yes, you would need a smartphone for this app, but of course there is still COVID Connect, which operates perfectly fine on a USSD phone. So you don't have to have a smartphone. Any simple phone that can receive SMSs will still work for COVID Connect. And just to recap, that COVID Connect, of course, is initiated by the system from government itself, whereby you do receive an SMS and then you would just need to manually upload your contacts, and that also is for free. Those are all the questions. Oh, okay. Dr. David Johnson has just uploaded another, I think it's a question and a comment. Apparently, phase 2 of Apple and Google system allowing users to receive notifications about the exposure to infectious people without needing to install the app. Will this then simply require an OS update? Then either Maria or Gaurang, I think, can answer that question. Thank you.
Lwazi, let me ask Maria to answer this.
Okay, Thanks, Goring, and thanks, Lwazi. So that announcement was made officially in the last 24 hours, but we have been chatting, obviously, to Google and Apple over the last few weeks, and we were aware that there were changes coming in the operating system. So firstly, we're very excited because this does mean that the system and the solution is being extended so that when borders eventually are opened, people will be able to travel, and then this system will still be very much in place, and automated contact tracing will be possible. We do want everybody to just to know that both Apple and Google have given us confirmation that they support South Africa's efforts, and that is a big message for us in saying that the app absolutely has legs, and all the work that we've done to date has absolutely, it's important and will extend into the future. So what we have seen is that the solution that does not require an app to be downloaded still requires a lot of the background work that is not seen to everyone. We all just see the app, but the app has so many other elements in bringing it together. And one of those being the validation server. So that's to validate that the positive diagnosis is in fact correct, as well as the key server, and that's for the exposure notifications. Those are absolutely still required, and that work has been done for South Africa. Our understanding is that both solutions can live quite comfortably next to each other. So if people have an app, and if people do not have an app, the exposure notifications will work between the two devices. And as I said, this was only announced in the last 24 hours, and we will do further investigations. But it's as fast as, and thank you for the compliment, that we were able to implement quickly. It has taken us a few weeks to get the application live and in the stores. This additional change, the express solution, will also require some further time, and it'll be a while before we can implement in South Africa. But we're investigating further, and we can see what changes will be required, if any. Thank you. Thanks.
Thank you very much, Maria. And also just to add to what Maria said, that indeed we did receive correspondence from Apple congratulating South Africa for really the speedy implementation of this technology. It appears that we've actually beaten many of our Western counterparts who are still, in fact, battling to have this implemented. So huge congratulations to all of those players, all of our partners, and the department officials who have been involved in this initiative. So I'm just going to have a quick check on my phone to make sure that I have not missed any questions there. No, it seems like we are covered. And so this does bring the session to a close, exactly almost 11 o'clock on the dot. Really, thank you so much to everybody who joined us for this webinar. I thank all the members of the media for their keen interest. And of course, just some quick reminders. First, download the app. It's only 3 megabytes. Secondly, keep your Bluetooth on. Thirdly, when you do go for a COVID-19 test, make sure that you provide the correct cell phone number. Fourth, we still have COVID Connect, which is still operational and working. And if you do nothing else, we will find you and prompt you through the pathway of care. And South Africans, yes, right now we are going through a trough in our epidemic, and this is all thanks to everybody who has really been wearing their masks, washing their hands, sanitizing their surfaces, and all of those very important NPIs. We now have even more armaments that we're adding to our COVID-19 efforts. We really want to encourage South Africans to keep up with the non-pharmaceutical interventions, because we still don't have a vaccine and we don't really have a cure. We're able to manage COVID-19 much better, but we don't have a cure, we don't have a vaccine. So NPIs remain very important. Contact tracing, whether it's digital or manual, is exceptionally important for breaking the chain of transmission. And if we can keep all of these things up, we will be able to maintain our position, or maybe even improve our position where we are now. So thank you very much to all the participants, all the partners, all members of the media. And this brings this media briefing to a close. Thank you all very much. Oh, and before I forget, I must say a special thank you to GCIS and the presidency and communicating the presidency for collaborating with the Department of Health to ensure that we are able to successfully launch this app and continue with the communications around this app to ensure that South Africans take this app on board. Thank you very much. This brings this session to a close.